We have thousands upon thousands of seniors that can't afford the medicine that's prescribed for them. We have them cutting pills in half.
George Corpius is president of the National Council of Senior Citizens.
The average income of a senior in America is $16,000 a year. 15 million of them are not covered at all, have no prescription drug coverage.
Why aren't old folks protected by Medicare as far as drug costs are concerned?
It's not part of the law. This is what we're trying to get done now. What we need to do is enact a universal, comprehensive prescription drug program under Medicare, so everybody is covered.
Many seniors who did have some drug coverage through private insurance plans have now lost it. For in just the past 18 months, nearly 1 million American seniors were told by their HMOs or their health plans that their drugs will no longer be covered. But now many seniors have discovered there are places they can get their drugs cheaper: Mexico and Canada.
Well, what's happening is that seniors in America have to pay 2 or 3 times the price for a drug that is sold in either Mexico or Canada.
And so the Seniors Council has organized and helped pay for several bus trips for seniors to go to Canada to buy their drugs. And we went along on one of those trips. The bus started in Portland, Maine, drove across New Hampshire, then up through Vermont, picking up about 40 seniors along the way. One of the seniors we met, Carolyn Swift, a retired English professor.
I feel that we are all, on this bus, we are refugees from the American healthcare system.
What do you mean?
We are all of us inadequately insured, struggling to take our medications, without which we will die. And thank goodness Canada is here.
Lena Sanford is a 73-year-old retiree from Cambridge, Massachusetts. And like most seniors who are having health difficulties, she has to take more drugs than the average American.
You take how many drugs every day?
I take about 16.
16?
Yeah.
What do you take?
I take 6 alone for my lung disease. I take pills for high blood pressure, anxiety, for arthritis. I got a whole list of them here.
How much every month for drugs?
My drugs comes to
$1,365.
For what I'm paying here in the United States, it'd be 1/3 over in Canada.
Lena's insurance used to cover that $1,365, but as we said, like millions of other seniors across the country, her insurance plan recently stopped paying for her drugs. So she went to Canada because it turns out the drug she needs cost more than her total monthly income of $1,200.
You know what I feel like, Mike? A convict.
A convict?
I'm leaving this country to go to another country, going over the border to get my medication so I can live. I think it's a disgrace.
The bus crossed over to Canada from Vermont, and once there, we followed the seniors to a Montreal drugstore where many of them had their prescriptions filled for about half the price they paid in the United States. Lena Sanford said that she saved more than $1,000.
This in American dollars, what we have here is $9.15.
Wow. That's good. That's great. And that's 2 months.
2 months supply, yeah.
Unbelievable.